Good afternoon and welcome to today's webinar, Reducing the Risk and Incidence of Falls Through Veteran Engagement. My name is Bethany Christensen. I'm with GetWellNetwork and I will be the operator on this call. Before we begin, I want to take you through how to use the GoToWebinar platform. All attendees are in listen-only mode. If you would like to ask a question, simply type it into the question box in your navigation pane. You can ask a question at any time during the webinar and we'll address them at the end of the call. It's now my pleasure to turn things over to my colleague, Dave Wright.
Okay, thanks, Bethany. I appreciate the introduction and the opening. Good afternoon, everybody. My name is Dave Wright. I am the Senior Vice President for Government Services Division. It is my pleasure to be your host today. Today's webinar, Reducing the Risk and Incidence of Falls Through Veteran Engagement, is the second in a series of best practice webinars we're hosting over this year. The goal for these webinars is to encourage and support optimal use of GetWell tools and resources in order to drive priority performance improvement. Following each webinar, a related case study will be available to you, and the session is also being recorded for access by those who could not attend today. The next webinar, scheduled for May 31st, will be focused on leveraging various GetWellNetwork tools to reduce the incidence of hospital-acquired infections. In terms of learning objectives for today, they're pretty straightforward. They are to increase the familiarity of the tools available through GetWellNetwork to support and facilitate advances in performance for our VA client partners, to learn how these tools can be used to improve sale performance in targeted areas, and to share just a couple of best practice examples where the use of these resources has resulted in significant reduction in falls per 1,000 patient days of care. I'd like to start with a bit of context. Much of this will be known by many of you already, but as you know, inpatient falls are among the most significant hospital-acquired injuries in today's healthcare market. On average, there are about 2 to 3 falls occurring for every 1,000 bed days of care. Falls directly impact the acuity of the veteran, and particularly when injury occurs, the result is increased cost and lower staff productivity. While there have been many studies that have been done, the literature is pretty clear that there really is no silver bullet for preventing or reducing falls in the inpatient setting. However, a study was completed at the University of Washington in the year 2007, noting that one of the principal reasons patients fall is that they are not aware of their risk of falling. The study went on to reflect that while nurses are diligent about completing the fall risk assessment upon admission and throughout the stay as needed, they don't necessarily communicate that risk to the patient. Research and our experience indicates that one of the most effective or proven ways to reduce the incidence of falls is by proactively engaging the veteran in fall safety management. Some time ago, GetWellNetwork worked together with clinical leaders to establish a simple, straightforward pathway that is really designed to reduce falls through patient engagement and activation. This fall prevention pathway can be triggered automatically, most often within 2 hours of admission, to begin the process of educating and engaging the veteran in fall safety management. At a macro level, the pathway begins by educating the veteran about what could cause them to fall, then educates them about what they can do to prevent a fall, and then engages them with prompts and reminders throughout their stay to seek assistance in order to prevent a fall. As mentioned, this pathway can be automatically triggered once we receive ADT information from CPRS regarding the veteran's admission. It also can be prescribed or launched at the bedside by the care team. The content, the timing of the prompts, and the triggers are all configurable by your facility. It's also important to ensure that the design of the pathway is aligned well with nursing practice so it fits into daily schedule and is not additive to work or the care process. It is also possible to send notifications to designated care team members regarding the veteran's self-assessed risk level and or completion of education. All of that is among the decisions that you will be making in designing and configuring this pathway. So let's dig a bit deeper. How does this pathway engage veterans? Let's assume it's 2 hours after admission. The veteran is prompted, encouraging them to complete a fall risk assessment. This does not replace the nursing assessment, but rather serves to build awareness and educates the veteran about what could cause them to fall. As noted before, this pathway can also be triggered right at the bedside since it resides in a priority space on the veteran experience. Let me stop here and go back for a second, because one of the things I want to mention to you is the priority space is completely configurable by you, and so it's not something you do have to use, but it is something that is available if you'd prefer to have this manually operated. So moving ahead, if the veteran does not respond to the prompt initially, it goes off into a queue and comes back a few more times at intervals and frequencies that are really defined by you, inviting the veteran to participate in fall safety management. If the veteran doesn't complete the pathway, a notification, if desired, can be triggered or can be sent to the appropriate staff members, and it can be triggered at a later time by the staff. To begin or to start, the veteran is asked to identify which risk factors are present for them. Again, even if there are no or few risk factors, this step really serves to build awareness of fall risk and what could cause a fall. Regardless of their self-assessment or self-rated level of risk, the veteran is then asked to watch a short video that specifically speaks to what the veteran can do to prevent a fall. We are recommending the use of a 4-minute video produced by Milner Fenwick. However, each facility can certainly choose the video used for this education. Following completion of the education, it is possible to evaluate their understanding and also ask the veteran if they're willing to participate in fall safety management. We often find that that serves to create a sense of accountability, and it serves to drive sustained veteran engagement. So certainly from that point and throughout this day, the veteran is really prompted with a message, as you can see here on the screen, to seek help. In other words, call, don't fall, when they need to get out of bed to minimize that risk of falling. The prompt is generally a small notification in the bottom right of the TV screen, as you see here, so it's not invasive or interruptive of their TV program. The number of prompts per day in the schedule are to be determined by you. In addition to the automated pathway, the same content can be triggered manually by the care team right at the bedside. Many VA medical centers are using this priority space, as you see on your screen, on GetWellNetwork to feature and provide this fall safety content. So it's simple, straightforward, and configurable, really based upon your facility needs, workflow, and care process. Certainly, as with all GetWellNetwork tools, it's important to monitor and measure the impact. Make changes, and where necessary, make adaptations to achieve the outcomes you're seeking. It's also important to track comparative trends over time to ensure that there is continuing and optimal impact from that pathway. There are a number of resources, as you see here, available through GetWellNetwork for use in evaluating the impact of this fall pathway, including a community benchmarking report that provides comparative data both among VA medical centers but also across commercial hospitals as well. There are certainly reports available through GetWellNetwork Management Console. As many of you know, the Management Console will be accessible to you for your use once the first phase of integration with CPRS has been rolled out across VA medical centers, which is occurring right now. In terms of measuring the outcome, we recommend looking at falls per 1,000 bed days of care and falls with injury per 1,000 bed days of care over time to really monitor trends, as you see in the graph here. We're also recommending that you look at the completion rate of the pathway to assess the causal relationship between the pathway and the resulting fall rate performance, as well as for use in determining how much of this pathway or the change in performance could be attributed to this pathway when you're evaluating the return on investment of this initiative. So where to from here? So certainly the most important thing is to really begin with an evaluation of historical falls data from your facility using your IPEC reports to see if this is an area you want to focus in on. It's also important to complete an inventory of all your fall safety initiatives to determine how best to align this pathway with initiatives underway. We then work together to design and configure the pathway to your specifications so that it best fits your environment and to meet your needs. We also will then build, load the pathway, and review that with you for final acceptance before launching in the facility. Excuse me. We'll also train staff on the pathway use before going live. And then once, of course, we are live, we'll work together with you to monitor impact over a period of time. One of the most important things I want to mention to you about this is if you are interested in implementing this pathway in your facility, we strongly encourage you to work with your IPC manager to do that. They will be able to guide your facility through the process, manage the process and timetable to bring your pathway live at your facility in a relatively short period of time. Your IPC manager can also provide you performance data summaries, similar to what you're seeing here, to look at both SHEP and SAIL measures to help you determine where your overall outcome focus areas will be. Commonly, depending on how your experience compares with benchmark data, typically national and regional benchmarks, you may choose, as in this example, fall reduction to be one of those focus areas. And once you've chosen your focus areas, the next thing we'll do is we will align the right functionality, proven over a period of time and most often validated by research, to align that functionality with the target outcome, ensure that functionality is in place to make sure that we are optimizing the opportunity to really improve performance through the use of these tools. So with that, let's take a look at a couple of case examples. Certainly there are quite a few case examples out there, but the two we want to highlight today is we're going to look at VA medical centers in Lebanon, Pennsylvania, and in East Orange, New Jersey. Both are leveraging fall prevention tools through GetWellNetwork to drive improved performance in fall safety. In each case, veterans are completing the initial assessment, as we talked about, and then are required to watch the fall safety video. Both facilities are also providing additional education that can be accessed as needed in priority space around fall safety. Both facilities are also prompting patients throughout the stay or throughout their hospital stay with that very simple message of call, don't fall. And the result on fall rates, fall impact has been very significant. So let's dig a little bit deeper and look at each one of these. We'll begin with Lebanon VA Medical Center, which is in VISN 4. Lebanon went live with GetWellNetwork's veteran experience in 2014. Today it is implemented or live in 110 beds in units including the ICU, med-surg, and short-stay rehab. The approach they took was to include a learn how to prevent falls priority space as part of their overall veteran experience. The medical center also created a multidisciplinary IPC steering committee which recommended that at bedside, nurses click on that falls priority space to actually manually trigger that pathway to ensure the veteran completion. That then prompts the veteran to complete that fall risk assessment, review the fall safety educational information, and as of Q4 fiscal year 2016, every 2 hours between 5 a.m. and 9 p.m., the veteran is prompted with a reminder of calling don't fall before they get out of bed. So as you see from the graph here, the reduction in fall rates, falls per 1,000 bed days of care has been significant. Since beginning this initiative, beginning with education and then again implementing fall safety prompts, we've seen a 45% change, or I should say Lebanon has seen a 45% change from baseline over fall quarters. Next, certainly we'll take a look at East Orange. East Orange is in New Jersey. It is located in VISN 3. They went live with GetWellNetwork's veteran experience in 2014. And they began leveraging the fall safety resources in May of 2015. Today, GetWellNetwork is located or is available in 163 beds in their units including ICU, medical neurology, substance abuse, hemodialysis, surgery, oncology, and others. The clinical staff at East Orange are trained to encourage veterans to learn how to prevent falls again in the priority space as part of their admission education and process. And depending on the falls patient risk, video education then is also launched for that patient. In October of 2016, inpatient units began delivering the prompt message of call, don't fall, and that occurs every 3 hours, reminding the veterans to seek help before they get out of bed. The results here very similarly are excellent, and they are significant, as you can see, with a 56% decrease in falls per 1,000 bed days of care and continuing decline over those 3 quarters. So to actually validate the impact, because we often get the question, how do you know that this falls pathway is actually leading to the impact or the performance change? So to validate that impact, GetWellNetwork engaged the research department at Thomas Jefferson University School of Public Health a few years back to complete a controlled study measuring the causality and impact of this pathway. There were 3 facilities of varying size and complexity that participated in this controlled study. And really, in a nutshell, the study confirmed that the pathway did have a direct correlating impact on fall rates. In fact, on average, the falls per 1,000 bed days of care actually dropped across all 3 facilities by about 60% over a 3-quarter period of time during the same term of the study. And given that it was a controlled study, so the study units obviously used the pathway, the controlled units did not, there was actually no change in fall rates on the control unit, and of course the 60% decline in fall rates in the controlled units. So lastly, it's important also to look at, as we do with any one of these areas, at the return on investment of this fall reduction strategy. So as we have noted, falls certainly lead to increased cost and lower productivity. When fall rates decline, it's certainly reasonable to expect that the facility will serve to see a cost reduction as well. So to evaluate that, we leverage an ROI methodology that was developed by a council of CFOs a few years back to look at the cost impact and performance impact over time. We also look at how much of that improvement in fall rates and costs can be attributed to veteran engagement, and in particular the use of this pathway. So it's important to note that the cost impact will vary by facility, and that really is based upon baseline performance, size of facility, level of utilization, certainly level of impact. So let me run you through a very quick example. What you can see here is we have the number of patient days for the facility or bed days of care. We have their falls per 1,000. We look at the actual number of falls, and then we look at the change in performance over a period of time. In this particular real-life example, there happens to be a change of 31% first year, dropping 25, then another 14%. And so this is a 56% change overall. We also look at, because where the real cost is incurred is when there's falls with injury per 1,000 bed days of care. So we look at that rate as well as the actual number of falls, and we assume, or the actual experience, is that the percentage of falls that have injury stay relatively constant. We apply a cost per fall, which is actually a national average. The low that we've seen in the literature is about 5,500, the high being 22,000 as produced by or reported by AHRQ. And so we took the median point that has been validated many times over. You can see what the total cost of the hospital of those injuries are. And as we reduce falls over a period of time, we are seeing a reduction in overall cost to that facility because of the reduced incidence of falls with injury. Because this facility had many other things they were doing around fall prevention, we only attributed 40% of this benefit based upon the causal relationship to the use of this pathway. So based upon the improvement in this, there's been about a $40,000 cost savings over 3 years, but it does not consider the impact on staff productivity. So, to summarize, the critical success factors in leveraging this pathway are, number one, identify fall reduction as a priority where needed. Not every facility needs that. Understand and support the benefit of veteran engagement and safety management. It certainly has been proven out over time. Implement the simple GetWellNetwork fall prevention pathway. Make sure that we align that pathway with other fall prevention initiatives so that it is effectively integrated into the care process. And then from there, let's monitor and measure, and where needed, if we're not seeing the kind of outcome we're looking for, to adapt that strategy as needed. So that concludes my portion of the presentation. I am going to turn it over to Bethany to take us to the next step.
Great, thanks, Dave. At this time, we will now take questions. To ask a question, go to the Q&A box on your navigation pane and type it in. Questions will be taken in the order they're received. If we don't get to yours during the webinar, please submit it in the post-conference survey and we'll follow up with you directly. All right, first question. Can we use the fall prevention pathway without interfaces?
That's actually a fantastic question, because we get asked by several VA medical centers who have not yet started the interface process, and the short answer to that is yes. There are several VA medical centers out there that are actually simulating ADT, and so we are identifying when the patient is admitted to the hospital, and we can use that just the same to trigger that pathway. Ideally, the automated process from an ADT feed through the interface is best. For those of you who are not familiar, the ADT is one of the very first things that we are doing in the interface, and as I said, that's being rolled out across all of the VA clients that we do have between now and really the September timeframe of this year.
Okay, great. I just got one more question. Can we get this presentation? And the answer is yes. We will be sending you a follow-up communication within the next few days with a link to this recording as well as a PDF of the slides. All right, I've got another one. Can we choose the educational content to be used in the pathway?
Well, the short answer on that is also most definitely. You know, as we have indicated throughout, we recommend the Milner-Fenwick video because it's a very well done video that speaks directly to the patient or to the veteran about exactly what their role and responsibility is. We've had some facilities produce their own videos, and that's perfectly fine. Or if there's other content either in our library or you found elsewhere, we can certainly load that content into the system. It's really more a choice of or decision about what you feel will be most effective with your patient population.
Okay, and Maureen Fuller, Bay Pines IPC manager, said that her facility is already using fall reduction videos in their mandatory education upon admission. Walking safety in the hospital is the one that they use.
In terms of the video, walking safety?
Yep.
Yeah, that's, you know, I think, again, you can use any video that you would like. You know, Maureen, on that particular case, and this really applies to everybody, I think the next step in the process, beyond mandatory education, is really to implement this pathway, which I know we've talked about. And, you know, that pathway adds to the education by enhancing the veteran's understanding about what does cause the fall, but it also sustains that engagement or that activation by the veteran over the course of the stay by giving those prompts of call and don't fall.
I've got one more question. Can you tell us more about where you got your data in the cost savings slide?
You know, certainly, you know, there are a lot of people that'll challenge, you know, because most facilities don't really monitor what the cost to treat a fall with injury is. But as I mentioned earlier, the literature, there's quite a bit of literature out there. If you Google or search through organizations like AHRQ, the range of cost to treat a fall depends, of course, on the severity, but the literature out there supports a range of between a low of $5,000 and a high of $22,000. We have had a few facilities on the commercial side that have been tracking their average cost to treat a fall with injury, and so we not only took the midpoint of that range that's in the literature, but that has been validated over a period of time. So it's a pretty safe number to use in terms of calculating what the impact, the cost impact, cost reduction impact would be when falls do decrease.
Okay, great. I see one or two people that have clicked the raise hand icon. Since you're in listen-only mode, if you could just chat it into the questions box, then we can read that on our screen and get to your question. I'm getting one more question. Yes, we will be sending out the slides. I promise. All right, it looks like there are no more questions. If we didn't get to yours in this webinar and you still have one, again, you can submit that in the post-conference survey. Can you click? All right, so that post-conference survey will pop up on your screen right at the end of this webinar. It takes just about a minute to complete, and we really appreciate your feedback. And as I mentioned, we will be following up with you to provide the presentation slides as well as a link to the webinar recording. This concludes today's webinar. Thank you, everyone, and have a great day.